Hello everyone, today I want to talk about something that genuinely surprises a lot of people when they first hear it, the idea that probiotics, those supplements, marketed as the ultimate solution for gut health, might actually be making some people feel worse, more bloated, more foggy, more uncomfortable than before they even started taking them. And I want to be clear right from the beginning, this isn't about probiotics being bad. It's about understanding why something so widely recommended can backfire for a meaningful number of people, and what the research actually says about it. Let's start with the basics. Probiotics are live microorganisms that, when consumed in adequate amounts, are intended to confer a health benefit on the host. That's the official definition. And there is genuine, solid research supporting their use for specific conditions. Certain strains have been well studied for things like antibiotic-associated diarrhea, some forms of IBS, and particular inflammatory bowel conditions. The science is real. But here's where most people go wrong. They treat probiotics like a universal gut fix. Something you take when your gut feels off, regardless of what's actually going on inside. Now let me give you an analogy that I think makes this click. Imagine you have a garden that's been disrupted, maybe a storm came through and knocked things around. You want to restore it. So you go to a garden center and buy a specific set of plants and put them in. But those plants are aggressive growers. They take up space, they compete for resources, and they crowd out the native plants that were trying to come back on their own. That's a simplified version of what may happen when you introduce a high-dose, multi-strain probiotic into a gut that isn't in the right condition to receive it. This brings us to a condition that is at the heart of a lot of probiotic-related symptom worsening, small intestinal bacterial overgrowth, or SIBO. According to research on the relationship between probiotic use and SIBO, certain probiotic strains, particularly lactobacillus species, can contribute to bacterial colonization in the small intestine in people who are already predisposed to overgrowth. The small intestine is supposed to be relatively low in bacteria. The large intestine is where the dense microbial population belongs. When bacteria accumulate in the small intestine in significant numbers, they ferment carbohydrates that shouldn't be fermented there, producing gas, causing bloating, abdominal pain, and in some cases, contributing to brain fog and fatigue. In a study examining probiotic use in patients with unexplained brain fog and bloating, a notable proportion tested positive for SIBO, and many reported that their symptoms had begun or worsened after starting probiotic supplementation. There's also the question of histamine. Some probiotic strains, again, particularly certain lactobacillus species, are histamine producers. They actually generate histamine as part of their metabolic activity. For most people, this isn't a problem. But for individuals who already have histamine intolerance, a condition where the body struggles to break down histamine efficiently, adding histamine-producing bacteria to the gut can intensify symptoms dramatically. We're talking headaches, skin flushing, heart palpitations, nasal congestion, and worsened digestive symptoms. According to research on histamine intolerance and gut microbiome composition, this is a frequently overlooked reason why some individuals react so poorly to probiotic supplements that work perfectly well for others. And then there's something more fundamental, the concept of strain specificity. Most commercial probiotics contain a handful of strains, usually chosen because they're easy to manufacture and have a reasonable shelf life, not necessarily because they're the most therapeutically relevant for every condition. Research on strain-specific effects in gut health consistently shows that what works for one gut condition may be entirely ineffective or counterproductive for another. Taking a probiotic without knowing which strains are relevant to your specific situation is a bit like taking a random medication without knowing what condition you have. The intention is good. The match may not be. So what should you actually do with all of this? First, if you're experiencing worsening bloating, increased gas, new brain fog, or any unusual symptoms after starting a probiotic, don't just push through assuming it's a die-off reaction. That's a term that gets misused a lot in wellness spaces. While some transient adjustment is normal, persistent worsening is a signal worth paying attention to. It may mean the particular strains you're taking aren't right for your situation, or that an underlying condition like SIBO or histamine intolerance needs to be addressed first. Second, research increasingly supports the idea that for many people, the most effective way to support gut microbiome health isn't through supplementation at all, it's through diet. Fermented foods like yogurt, kefir, kimchi, and sauerkraut provide live bacteria in a food matrix that appears to be better tolerated and better integrated by the gut than high-dose capsules. A large dietary intervention study found that increasing fermented food intake consistently improved microbiome diversity without the kinds of adverse responses that isolated probiotic supplements can trigger in sensitive individuals. Third, If you're dealing with persistent gut symptoms, working with a healthcare provider to rule out SIBO histamine intolerance, or other underlying issues before reaching for a probiotic makes a real difference. Because sometimes, the kindest thing you can do for your gut isn't to add more bacteria to it. Sometimes it's to first understand what's already going wrong. Probiotics are not a scam. They are not universally harmful, but they are also not a one-size-fits-all solution, and the evidence is clear on that. Understanding your own gut, rather than following generic advice, is always going to be the more powerful approach. Thank you so much for watching. Take care of your gut and take care of it wisely.